Greetings. How's everybody out there doing? I hope everyone is doing well. I am Tamika Gray L, and the subject today is healing touch. You can probably hear my bird in the background because she'd like for me to be talking to her. If she gets some of this, hey, she can have it. Again, I'm Tamika Gray L. I'm a nurse practitioner. I am an Ayurvedic practitioner. I practice many methods of holistic healing, including Ryoko Usui Reiki, Karuna Ki Reiki, some healing touch. I work with some Armanis. I'm an Ayurvedic practitioner as well. So, like I said, today this video is actually about healing touch. And healing touch is a therapeutic modality that's it's really close to my heart. But all the healing modalities that I work with are close to my heart. But healing touch has a different significance for me in the sense that as a nurse, we're taught in nursing school that it's that health, that love, that healing, that love, that touching that a patient sometimes needs that they don't get from providers, right? So as nurses, we're taught how to give back rubs. We're taught how to sit with the client. We're taught to touch the client. And some things, now we have so much going on in this world, so many infections and things like that, that some of that gets lost. Healing touch seeks to keep some of that there. We have people who, although right now with COVID-19 pandemic, I can understand wearing gloves when we wouldn't have worn them before. However, there's sometimes that people were wearing gloves even before now that it just really wasn't necessary. So that in and of itself is part of the reason why healing touch first was so near and dear to me. The power of touch has been addressed and is part of almost every culture. We look back at Egyptian cultures, Native American cultures, every culture, there was something. And it's something that we know works because think about this. If a child gets hurt and comes to mom touches that child, and that energy transfer is really important. It doesn't mean that the boo boo went away, but mentally and comfort wise, the boo boo went away. Like I said, I'm a nurse, and as a part of my formal training, I learned about Florence Nightingale and Mary Seacole, and they believed in the power of touch, and so do I. With healing touch therapy, practitioners use their hands to balance, center, and re-energize the client or the patient. They use these light touch, very light touch, or near body touch to parts of the body where some form of pain exists. Now, I'm going to say some form of pain because not all pain is physical, right? But all pain can ultimately become physical. I'll say that again. Not all pain is physical, but all pain can ultimately become physical. So this very light touch or near body touch is used to influence the energy field that goes around the person and permeates through and into the person. When practitioners practice healing touch or touch therapy, it's important to come from a place of compassion, heart-centeredness, love, and to be present during the time that the interaction is occurring. Very, very, very important. How many times throughout each one of our days do we do something and it went by quickly and we're like, I don't even really remember doing that. Well, when it comes to healing touch and touch therapies, and when it comes to working with other people, it's very important that we are centered, that we do set an intention, that we are with the client that we're working with or the person that we're working with. Because this can be a family member, it doesn't have to be a paid client, it can even be you know. Um, Practitioners who use healing touch, they basically use this light touch or very light touch or near body touch to open, balance, and clear energy systems in the mind, body, and spirit. It's important to clear those. I had to think about what I wanted to say and how to say it really quick because mind, body, and spirit is what we are. How we think, how we feel, how we act, how we behave has such an impact on our physical bodies that when that gets thrown off or when we're behaving, acting in a certain way, when we're treating ourselves a certain way, what ultimately can happen is, yeah, we get into a state of dis-ease. So, what actually happens you are when a client is receiving healing touch? The client may immediately feel nothing. They may immediately feel calm, peaceful, relaxed. They may feel by the time that you're done or throughout pain relief. They may feel whatever pain or heaviness that they were feeling move to different areas until it's gone out of the body. They may feel warmth. They may feel tingling at the site. So, say there's some healing touch going on and it's at someone's forehead. They may feel warmth um, from the hand or within their head or within their body mind. There are no known side effects to performing healing touch. However, I have some recommendations, though. As we are, you know, dealing with people, and people are not all the same. There's no carbon copies, even though there may be two people who appear to look or act just alike. They're not carbon copies. And we also have to consider what else is going on with that person. Are there any physical or mental or spiritual conditions that we need to look at? And consider when we're performing this, because remember, healing touch is going to that energy body that is within us, and it's a way that cleanses some things. It opens up and purifies the nadis. It helps with the chakras. Consider any mental conditions that a client might have. Consider any emotional or trauma issues that they may be experiencing now or may have experienced before. Watch for any nonverbal cues, because sometimes we can say, "How are you doing? Are you okay? How does that feel?" And the person says, "Oh, I'm fine." And they're really not. How many times have you just seen that in regular everyday life? How many times have you responded that way? So pay attention to nonverbal cues and be aware of any physical diagnoses that exist for the client or the person that you're working with. Any cardiovascular issues, any brain issues, be aware of those things, and don't just jump out and decide that, okay, I've read about this, I've learned this, I've seen a video about this, and you're just jumping out there and you're doing it all willy nilly. There are ethics to everything. And ethically, if you don't take time to get to know the client, get to know um, what their issues are, what their needs are, other things that may be impacting what you can and cannot do or should not do, then you're not practicing ethically, whether you're an actual practitioner or if you are just someone who wants to help people. You got to take all these things into consideration. Not only that, but healing touch or any other complementary therapy is never meant to uh, take over and supersede and stop people from going to see their licensed medical providers. It can be used as an accompaniment. But again, you want to be sure that you're looking at the whole person. If training is offered for healing touch, you want to go get trained. Yes, you can read. But a mentor of mine said, "Can you learn how to play?" This is an example. Can you learn how to play football by reading a book about playing football? Can you? Can you learn about football by simply reading a book about football? Yeah, I when I originally heard it, I was like, of course I can, because I can read and I can absorb things. The reality of it is, do you learn about just by reading? Do you learn the little nuances like when are you going to go there? When you get there, how's that going to be? What about tickets? Where do you get the tickets from? What is the culture of the game itself? How's it going to feel? What do you do? What people are you around? Yeah, most of that's probably not going to be in a book. And even if it is in a book, it's not going to be in a way where we all necessarily observe it and absorb it and learn it. So it's the same for talking about any healing method, including healing touch. If there's training available, go get training. Ethically, we shouldn't be willy nilly practicing on anyone, including ourselves. Keep in mind the laws of where you live. Healing touch should never take the place of good, sound medical advice and medical care by a licensed and certified medical provider. And have fun with it. once you're doing it. Start with yourself. Make sure, though, that if you do, you talk with your medical provider about what you're going to do. And make sure that if you're using any type of healing technique on anyone else, you make sure that they talk to their medical provider too. Okay, it's been fun telling you about healing touch and giving you a little hand example. It's been great. It's been real. And I hope to see you soon. Namaste.